Hey, this is a banded four-way hip. You can also do this on a cable machine with an ankle cuff. But I have a band down low, ankle height, and I just have my leg inside it. I'm gonna start with a balance support. This could be anything, a countertop if it's nearby, like having a PVC or a dowel or a broomstick. I'm gonna start with balance support. I like to progress to without it, and I'll show both. But the four-way hip, I'm gonna set up bandages on the inside leg to start. My outside leg, I'm gonna be standing on it. I'm gonna have this stick in the opposite hand, knee over center of the foot, toes gently pressing into the ground. And way number one, direction number one, is adduction or inward. And so the band is pull my leg out, I'm pulling it in. On all of these, I'm trying not to lean to the side, trying to keep my low back relaxed. But we're gonna feel some work definitely on the leg that's moving, but usually we should feel it also on the stance leg, on the same inside adductor groin muscle, but potentially on the glute of the standing leg and the toes and foot on the standing leg if we're using those to help us stabilize, pressing down and flat, not curling. But way number one is adduction. And then I'm just gonna slowly turn kind of a square. Number two is hip flexion or a straight leg going forward. So I'm gonna squeeze my quad all the way. We can work quad and hip flexor. And I'm gonna come forward, working the front of the hip. As the leg comes back, I don't wanna arch my back. And I wanna go as far forward as I can without the band rolling up my leg. Working the front of the leg, but try not to have any extra low back movement. I make another turn. My back is gonna be to the camera here. I'm gonna move my stance leg so that the band is in front of it. This one is the hardest one I find to balance on, so I want to show I'm slight bend of the knee and hip coming out. And I'm trying to use my glute on my standing leg, glute on my working leg, gently pressing toes in the ground. This one tends to be the hardest on the standing leg. And the most need for balance support. Final direction, I'm going to face this way, again, slight bend of the knee and hip, and bring my leg back. On this one, I want to make sure as my leg comes back, I'm squeezing the glute, maybe hamstring, not arching my back. That's the most common compensation, is arching the back. I want to try and squeeze the glute. And this one, I like to let the leg come pretty far forward. The more forward it is, the more room I have to get a good action of the glute. I'll typically go 10 to 20 reps in each direction, working my way around. And then eventually I like to progress to no balance support. So now this is a lot of work on my standing leg too, and I'm trying to keep from wobbling at the knee and keep from wobbling at the back. So the whole time we want to work inside of the leg, front of the leg, outside of the hips, back of the leg. If you're feeling it somewhere else, the knee, the ankle, the low back, pause, check your position, add some additional balance support even in the other hand, so that way we can get a clean muscle action of what we're intending without a compensation. So this can be a hallmark for me in management of tendon pain around the hip, or just trying to get strength around the hips when we have pain in another area, maybe because these muscles aren't quite as strong as we want them to be. Of course, if you're dealing with pain, check with your healthcare provider, but the four-way hip can be a great exercise to add to a program when we want some isolation of specific muscles. It's not necessarily the end-all be-all. We usually want something where we can progress to some heavier loading, but it can be a great option to add some volume and treat specifically some strength and balance around the hip. I'll also just say that not every direction might require the same tension, so you can come inward and outward as needed, or you can put 2 or 3 bands on the same anchor point and just swap out as needed if one direction is at a different level than another. I typically want between 10 and 20 reps to a high level of fatigue, and if you can do 20, then I typically increase the resistance by moving out a bit. Maybe 25, but if you can do more than 25, I want to make it harder, so add resistance, add a band, go up in band tension, something like that.